Hello and welcome to this tutorial about analgesic medications. Okay, the objectives of this tutorial will be to discuss some common analgesic medications. We'll discuss how they work. We'll discuss any contraindications, routes of administration and storage. Okay, so the first one is a common drug that we can buy over the counter. We can get it from supermarkets even, and that's paracetamol. A brand name of paracetamol is Panadol. Okay, and the indications for a patient receiving paracetamol is that they would be suffering from mild pain and or a fever. Okay, so Panadol has some antipyretic properties as well, which basically means that it will reduce a fever. Okay, and the analgesic properties, so analgesic is pain relief, so it relieves mild pain. Okay. Now, we must not give paracetamol to patients who have had a history of liver failure or renal failure, because it can certainly damage the liver and kidneys. And paracetamol comes in tablet form, it comes in dispersible tablets, and it can come in a liquid, especially for young children or older adults that are unable to swallow tablets. It can also come in a suppository form. You can actually get it in intravenous form in a hospital setting as well, and it should be stored at room temperature. Another common drug that you may have heard of that can be given to relieve pain is something called Nurofen. That's the brand name. The trade name is actually ibuprofen. Okay. Another one is aspirin. And these two types of medications are often referred to as non-steroidal anti-inflammatory in medications. It's a mouthful, which is why the term is shortened to NSAID. Okay? So aspirin or ibuprofen can be given for mild pain relief or relief of fever, because they both also have antipyretic properties as well. And again, they shouldn't be given to patients who have liver failure or renal failure or gastrointestinal disease, because they can upset the stomach and potentially lead to stomach ulcers. Very important that if we have patients who are taking aspirin or ibuprofen, that they do so with food. You can get aspirin in tablet form, dispersible tablets, and you can get ibuprofen in tablet form or a liquid as well. Okay, the dispersible tablets are specifically for aspirin. Aspirin is also a mild blood thinner as well. It stops the platelets from sticking together in the blood. And these should be stored at room temperature. Okay, so another common medication that you may have heard about is something called morphine. So morphine is a very, very strong painkiller, and this is subject to extra legal requirements. Registered nurses should be administering morphine. Okay, so people will receive morphine for moderate or severe pain relief. You may also come across some patients in palliative care who are in morphine because they're towards the end of life and they may be in a lot of pain. Okay, so morphine shouldn't be given to anybody who has an opioid allergy or respiratory depression. Opioid is it's a type of medication that morphine is. There's a number of different medications in that category, but morphine is classed as an opioid. And one of the red flags, I guess, with morphine that we need to be aware of is that it can cause respiratory depression. Okay, this means that our patients can ultimately stop breathing if they have too much, if they have a very large dose of it. So we need to be very careful when administering morphine and monitor our patients closely. Okay, so we can get morphine in lots of different formulations. It can come in tablets, it can come in a liquid suspension, which is what you see here, an oral solution called Oromorph. It can also be administered intravenously, IV, intramuscularly, IM, or subcutaneously, SC, by injection. And this would be stored at room temperature as well. Okay, so fentanyl is also given for moderate to severe pain relief and can be given as an anaesthetic agent as well, because it can put you to sleep if you're given a large dose of this. Again, the contraindications are an opioid allergy, because it is an opioid medication similar to morphine, and it can result in respiratory depression. So there's our red flag. Okay. Very aware, monitor our patients' breathing, and be very aware of the dose that you're giving, that it's not too much, because it can cause respiratory depression in our patients. Okay, so it comes in different formulations. We could get this as a patch, which is administered slowly through the skin. It can also come in intravenous format, intramuscular format, and in a subcutaneous injection. This would be stored at room temperature. So in summary, if we could just ask you to read these questions and just pause for a moment and answer these questions. If you pause the video now. Okay, so when thinking about what drug a patient would use for a simple headache, is there anything you could think of? Okay, so paracetamol would be a really good option for a simple headache. You can buy it over the counter, you can get it from your local pharmacy or your shop. It's very easy to get hold of. So paracetamol would be the answer to that question. Okay, so what drug might be used to sedate a patient in theatre? So we did just talk about fentanyl and how that can be used as a sedative as well. So we could use fentanyl or morphine. More often than not, it would be fentanyl. Okay, and question number 3, what drug could be given to a patient suffering from pain after having a hip replacement? Again, you'd be in a lot of pain after a hip replacement, so we would be looking at fentanyl or morphine. Again, it may be that they're on a fentanyl patch, or they could be having fentanyl or morphine via an intravenous infusion. Okay, thank you very much for listening to this tutorial. I hope you enjoyed learning about analgesic medications.